Dear friends, today I am with Dr. David Emerson. They have a clinic here in the country called Emerson Clinic. And where are we exactly?
We're in Myersville, Maryland, between Hagerstown and Frederick.
Okay, great. So it's in the countryside. It's really beautiful, really nice. You're going to see some shots of the property there. And so what do you, I know that you see patients, but what type of patients do you have here?
Well, we see a lot of patients with hypertension, diabetes, weight problems, coronary artery disease, which are all very responsive to a vegan, oil-free diet. Then we also see patients with cancer that are looking for supportive care, and we do advice. We give them a course, things that they can do at home to help fight cancer, support them in their battle. Things like a plant-based diet. We do oil-free diet. We recommend pressed juices. There's evidence for that being helpful. We also do fever therapy, where the fevers turn on the immune system, which helps fight cancers. And then we also recommend intravenous vitamin C. Linus Pauling has done studies in 1978 showing that it extended the life of terminal cancer patients from 50 days to over 350 days. So those are the things that we implement here. We have a program where we just talk to patients and share with them what they can do at home.
Educational programs in a way?
Yeah, this is educational. And then we also have 3-day, what we call intensives, where if a person wants to come for 3 days, we give them all the lectures. We have a lifestyle intensive where we talk about how to reverse heart disease, diabetes, hypertension. This is diabetes type 2, hypertension, weight control. We give them the lectures and the cooking classes and all. Then we have a 3-day intensive for cancer support where they come and we show them how to implement these modalities. We have cooking classes, show them how to do a proper diet. We also show them how to do the juicing and how to do the fever therapies. We actually give them the fever therapies. And then we do intravenous vitamin C. And these have all been shown to be very, very helpful.
Great, great. So that's like in a nutshell, right?
That's right.
What you do. Now being here, I've noticed this is where you live, right?
That's right. This is a home office.
So we could say that all those lifestyle programs that you run them here at your own home.
That's right.
Cool.
Yes.
So it's like a home lifestyle center in a way, right?
That's right. Yes. It turns out that things we do are pretty simple that can be done at home, most of them. And that's the beauty of it, because in 3 days you can't reverse things, that quick. But helping support in cancer, it's more of an endurance sport rather than a sprint. It takes a long time. And so our job is to, instead of having this like a vacation spa, we like to think of it more of as a boot camp where we're training you what to do when you go home. We've had some patients go through lifestyle center programs and they get home and say, well, I'm home now. Now what do I do?
Yeah, true.
So when they're here, they do hands-on. We actually have them do the juicing themselves. We have them press the juice, and we have them help with the cooking. With the hydrotherapy, each day we do a hydrotherapy for the patient, for the cancer patients. And my wife will show them how to do it with a helper. So a cancer patient will bring a helper, and the helper then watches the first day. The second day, the helper helps my wife as she does the fever therapy. And then on the third day, the helper does the whole thing and my wife just watches. So when they go home, they're already up and running.
That's really cool, really nice methodology, because they're getting educated, but at the same time trained to continue doing this at home. Yeah, because I know in most of the places I've visited as well, most of the lifestyle centers, the guest is just a guest, just goes there, they do this, do that, and they participate to many things. But it's different when you're, okay, now do it yourself,
Oh, yeah.
So it's really nice that you're doing that. And how many guests can you have here at the same time for a program?
We usually have one or two guests, and each guest, if it's a cancer program, they're required to bring a helper with them, so that the helper can help them with, especially the water baths, the fever baths. Some cancer patients are too weak to really do the food preparations and do the juicing themselves, and so the helper is going to be the main one to do that. Others, they're up and running and they've got a lot of energy, and they can do the juicing themselves.
You know, this is great because friends, I know that in other interviews we've seen this, but I mean, we've mentioned this, that we can start a lifestyle center just on your house. You don't need a big building, an enormous staff, to start a lifestyle center.
That's right.
Dr. Emerson started here at his own house with having just two guests, but amazing testimonies and stories that you will see in other interviews. But it's really cool. And now I do have another question. This is like we're gonna shift conversation, but it has a lot to do with what you're doing right now. You're a physician, right?
That's right.
How did you ended up in natural remedies? Because you know that you went to school, medicine school, and you usually train to just have a normal
Normal life.
normal life that others do. But how did you get into natural remedies and you wanted to start this?
Just before I went to medical school, I became a Seventh-day Adventist Christian, accepted Christ as a personal Savior. In medical school, I was attending a church, and somebody came up and said, well, you're going to medical school. Why don't you give us a health nugget, 5-minute talk on our health message? I said, oh, that'd be great. I'd love to. We have a health message? And I said, well, yeah, don't you know about it? I said, well, no, not really. And so they said, well, here's Dr. Crane's phone number. He's up at Weimar, and you talk to him, and he'll tell you what you can talk about. I said, oh, really? Okay. Well, now at that point, I had a herniated disc, my back, lower back, causing severe pain down my left leg, and I'd have to walk crooked, and I was going to get surgery from a neurosurgeon there that I was rotating with. And but I talked to Dr. Crane about it. He says, well, you need to try gravity traction and then McKenzie exercise. And gravity traction is where you kind of you can have a girdle around your chest, and you kind of on a slant board, it holds your body up, and the gravity of your trunk pulls it down and kind of puts your back in traction. Or you can do it, with putting your arms on a counter like this, and bend your knees, and that puts your back in traction. And that relaxes the muscles, because when you have a herniated disc, it's pinching the nerve, and your muscles will spasm to try to open up that nerve exiting. And so the muscles are spasmed, but the traction relaxes those muscles, and that can relieve your pain. And then you do the McKenzie exercises, where you lay on the floor and you push up with your arms, and it arches your back, and you push the disc back in place. Well, they recommended a slant board at 30 degrees, but I was real anxious and I was really motivated. I put it at 80 degrees, and I was just hanging there on this board at night for 4 or 5 minutes. But when I did it, I could sleep at night without the pain.
Wow,
It relaxed the muscles. And then I worked with a physical therapist, and he helped me do the back arches, and I would get 1 inch off, and I'd feel the pain. I'd have to hold it there for, like 30 seconds, and then I'd relax. And then I'd do it again, and now I could go up 2 inches, and then the next time 3 inches. And finally, I got full extension, and when I went down, the back pain was gone. And this is what Dr. Crane was telling me. I said, wow, this really works. I mean, there's something to this. And I was able to avoid surgery. And I would have to do those exercises 4 or 5 times the first day, but then the second day, maybe only 3 or 4 times. By the end of the week, I wasn't having to do them at all. But I did notice if I'm on call for a couple of days in a row, I lack the sleep, it'll come back. I'll have to go through the process again, but I know what to do now.
Yeah.
And so the gravity traction and McKenzie exercises, Robin McKenzie has a book out that describes it. It's Treat Your Own Back book. And he has one for the neck as well.
Nice.
So I thought, well, this is amazing. I really need to see what they're doing up at Weimar. So I called him, and I got to go on as a professional observer. And when I got up there, I followed the doctors there. It was Dr. Sidney Nixon, wonderful guy, and he'd see the patients and just slowly taper them off their blood pressure medicines or their diabetic medications, and that was all they were doing. And I was saying, what are they doing? I mean, there's nothing heroic about this. They're just taking them off their medicines. And it was the cooks that were doing all the work. They would help the patients over their 11-day or 17-day program, and they would put them on a plant-based diet without the oils. And we tend to be used to really high-fat diets, and we can become addicted to it. It usually takes about 10 days to get over that addiction. So the patient would complain the first 10 days, but then on the 11th day, they say, oh, you got a new cook. I said, no, you're just over the fat addiction.
Yeah.
So, and now the food tastes wonderful. I was really amazed. I said, this is phenomenal. I'm sure my classmates are going to want to hear about this, but I shared about this, and there really wasn't much interest, because it was kind of like, how am I going to pay my school loans off with this? I mean, that was the challenge at the time. So, but that got me excited about it, and started reading some books. This was the 1980s. One of the leaders, John McDougall, a medical doctor, wrote some tremendous books on lifestyle medicine, McDougall's Medicine and all, showing how a plant-based diet can reverse a lot of these problems that are plaguing Americans. So then went through medical school, then graduated, and then did residency out in Kettering, Ohio, and did some talks. They had some conferences down at Wildwood Lifestyle Center, and I met Neil Nedley there. That was when he was just getting started in lifestyle medicine. And I got married. We took my new wife out to Guam. And there, after World War II, they had excellent health. They were on a plant-based diet out there. But after World War II, they adopted the American lifestyle. And by the time we got there, early 1990s, diabetes was number one problem. Heart disease was number two problem. It was rampant. So we set up a lifestyle program. They would come after hours in the evening after work, and we'd give them cooking classes, health talks, and the whole thing, and get them on a plant-based diet. And the before and after tests showed that tremendous results. Blood pressures drop, weight drops, blood sugars drop, and slowly taper them off their medications. And then we returned, after spending about 8 years there, we returned to Ardmore, Oklahoma, set up practice there, and did the same thing, internal medicine practice, admitting patients to the hospital, and then doing the lifestyle work in our clinic. And then went to a lifestyle center. We were called to do lifestyle work after about 8 years in Ardmore, Oklahoma. Out in Colorado, we served out there for about 3 years. And that really got us introduced to lifestyle medicine. They saw a lot of cancer patients there.
In Eden Valley?
At Eden Valley. This was Dr. Cherney, and a wonderful guy, very godly man, recently passed away. But there were many cancer patients. We started getting used to cancer support, helping support patients in their battles. And then we came out in 2013 out here to our ancestral home. Our ancestors came here from Austria in the 1700s, set up a little one-room cabin in the back, and then in the 1800s they built the house we're in now. So we fixed it up and got a permit to have a home office here. And so we've been seeing patients out of our office here and trying to move them to a plant-based diet and help them get off their medications. And we also have been able to do weekend seminars at different churches where we present these. We have a lifestyle course, and then we have a cancer course that we do on the weekend, and to introduce people to these concepts.
Awesome. I'm curious because you mentioned like a lot of experience with doctors, but did any book of Ellen G. White impacted also your view on this?
Uh, yes, when I was first learning about Ellen White, I was thinking, who is she? What is she? What does she claim to be? And she wrote some statements in the 1800s that the meat products, said this was back in a time where it was felt that meat was essential for your strength and endurance. She said that it could cause seizures, paralysis, sudden death, and it affects the brain, the lungs, uh, and the heart. And I said, how did she know what organs the meat would because we know it causes a stroke, that's the brain, heart attack, that's the heart.
Yeah.
It causes seizures when you get a stroke, and paralysis and sudden death, heart attack and stroke. How did she know this back in 1800s? It was one of the things that clued me in that she's got another source. Okay,
Yeah, correct,
she's
correct.
got a connection with God. She also said something about smoking. And again, she identified the organs and the symptoms you would get if you smoke. And this is back when if you had pneumonia, you see a doctor and he might prescribe cigarettes to cure
Yeah.
your pneumonia. And she said, again, it would affect the brain, the heart, the lungs. We know stroke, heart attack, emphysema, lung cancers. And it would cause paralysis and convulsions, seizures, and sudden death. And we didn't learn this. She was writing this in the 1800s. We didn't learn this till 1945 to 1955, where we started seeing association with cholesterol and heart attacks, strokes with the Framingham studies. And later on, the dangers of smoking is just phenomenal. So that, gave me a lot of confidence that, what she's saying was really useful, and it's currently now being shown to be well-founded. And so those books were very helpful. She wrote things about oils. There's a lot of controversy about oils now.
Yeah.
We have a lot of patients come to us with, they don't understand. I'm a vegetarian, and I've been a vegetarian all my life. Why do I have problems with obesity, hypertension, diabetes? What's going on here? And it turns out that recent studies seem that it's oxidized oils that seem to be the problem.
Yeah.
Um,
French fries are vegan, so.
well, yeah.
But
And
we're not
so,
gonna eat French fries all day.
no. Well, it turns out that insulin resistance can be caused by the animal fats, but also with oils. And one demonstration was Dr. Vogel. He's a cardiologist. Turns out that insulin dilates arteries, and with insulin resistance, arteries don't dilate. So he put a blood pressure cuff on the arm of students, shut off the blood supply for 5 minutes to the arm, released the cuff, and the arteries dilated. No insulin resistance, the arteries were healthy, and they dilated. Then the next day, he gives them 50 grams of animal fat, released the cuff, arteries didn't dilate.
Wow.
It was like, wow, this animal fat caused insulin resistance. Just a meal. He said, well, okay, next day, that's an unhealthy fat. Let's use olive oil. So the next day, he released the cuff. After 50 grams of olive oil, arteries didn't dilate. He says, oh, no, this is strange. What's going on here? Well, maybe it's oxidized olive oil. That's the problem. So the next day, he gave him 6 capsules of antioxidants. These are ground up, dried vegetable matter, ground up, and put in capsules, 6 capsules, then 50 grams of olive oil, released the cuff, the arteries dilated. It appeared that the antioxidants were taking the oxidized olive oil and reducing it back to its unoxidized state and getting rid of the insulin resistance. And then the next question was, well, I wonder if God put antioxidants in the olive to protect us from the effects of the olive oil. So another group went to an olive press where they were pressing the olives, and they went there, and the guy said, oh, you want some olive oil? And I said, no, we want the wastewater, the mill water that you're throwing away. He said, oh, help yourself, And so they took it, and they found huge amounts of our body's main antioxidant, which is glutathione, in the wastewater that they were throwing away. And when they took the water and gave it to volunteers, their glutathione level in their blood rose dramatically. And so the idea is that the olive oil in the olive is protected by the antioxidants. It's also protected from exposure to air by a skin. But when you press it, you are losing the antioxidants, you're exposing it to air, it becomes oxidized, and now it can cause a problem. And that makes what Ellen White said very interesting, because she says olive oil, as eaten in the olive, is most beneficial. I said, well, that's a strange way of saying olive oil is healthy.
Yeah,
She didn't say olive oil is healthy. She said olive oil is eaten in the olive, because in the olive it's unoxidized. But unfortunately, on one of the publications, it made a little footnote, and it said, down the footnote, it said, see, Ellen White endorsed the use of olive oil. I said, that's not what she said.
yeah.
So,
Get it.
so anyway, those are,
Oh, interesting.
she said a lot of interesting things there that we're just now starting to understand why she said them that way.
Yeah, great. Great. No, I understand it because it even affects my own life. I remember uh I wasn't, well, in the beginning I wasn't like a big fan of Ellen White, you know. For me it was like, yeah, it's like whatever she says, it's like take it or leave it, you know. But I remember when all these documentaries started coming out about, like, I don't know, for example, Forks Over Knife and Sit Fat and Nearly Dead and all those.
Yes.
I remember when I saw my first one, I was like very impacted. I was like, wow, this is really interesting. But at the same time, I was a little bit sad because it was like, it's sad that I'm believing this now because I saw it and it wasn't by faith,
Mm.
you know, because from there on, I remember that I had a very spiritual shift in my life because I said, it's like, no, you know, I shouldn't wait to see something to then start believing what our prophet is saying like years ago, you know. So now it really had a change, but I think it happens to many people, not just me, but many go through the same situation, you know, of maybe being reluctant to Ellen G. White and the health message, you know, and what's the matter if this is clean meat anyways, you know, and I get it because I had the exact same perspective, you know, so I get it in a way, but God gives us that message so we can have lives that can be in a perfect state to connect better with Him as well. So it's a tremendous benefit, not just for our healthy life, but also for our spiritual life as well. Oh, well. Friends, this interview has been really nice, really interesting. And for closing, I would like you to talk to our friends here, because maybe there's a physician here watching. What do you tell to a physician about what he can do with his career for others and maybe in get into natural remedies?
That's true. Essential hypertension, which is 95% of hypertensives, responds to a plant-based oil-free diet. Usually takes about 10 days on a strict diet like this before blood pressures drop. And if you counsel patients in this manner to try it, be sure you're having them watch their blood pressures, because it can drop usually around day 10 significantly, and you need to get them off their or taper them off their medicines so they don't pass out. Usually blood sugars may drop in as little as 3 days on a type 2 diabetics. And so if they're on insulin, sometimes if they come to a lifestyle program where we know what they're going to be eating and they're going to be doing it, we'll cut the insulin in half on day 1. If they're on pills, we usually can hold the pills and let the blood sugars run high for a day or 2, but they do tend to come down. Weight control. Weight, usually they may lose 8 to 10 pounds the first week, but most of that is water. Maybe only 2 pounds would be fat. They typically will lose 1 to 2 pounds a week on a plant-based oil-free diet. It's generally what we see. Those are predictable and reversible problems, and there's usually a very consistent response to those types of problems. Coronary artery disease, studies by Pritikin, Esselstyn, Ornish have shown arteries can open up on that program. Generally, atherosclerotic plaque takes about a year before and after angiograms show significant opening. But chest pain Ornish showed drops by 91% in about 24 days. And that's because you're getting rid of insulin resistance. Insulin resistance doesn't take a year to get rid of, like getting rid of plaque. Insulin resistance can go in, 3 days, 2 weeks or so. And when that happens, insulin dilates arteries. When the arteries dilate, then it can decrease the chest pain. And he noted a 91% drop in chest pain as little as 24 days. And these are things that are fairly simple for patients to do, that they can try. And then they just need to be monitored. So if they're on medicines, you can taper off the medicines as they respond. And those are simple things.
Great.
Yeah.
Great. Friends, you know that it's not that difficult. If God has given you a call, if God is telling you, hey, if you want to start a lifestyle center, God put you that burden on your heart, and you see that God is calling you to do that, don't wait to have an enormous staff and maybe the building that you're dreaming of. Maybe that's going to be for the future. But remember, you can start with your home.
I should mention one other thing.
Yeah.
Pritikin in the 1970s reversed his own heart disease with a plant-based diet, and he wanted to share it with others. He did it basically with no capital, no lifestyle center. He went to a hotel. He arranged to rent their lecture hall. The patients would come and rent the rooms from the hotel. He trained the staff, the cooking staff at the hotel, how to make the plant-based, oil-free diet.
So cool.
Patients would go there, and he would give them the lectures in the hall. He would walk them on the beach. They would be doing great with essentially no capital. Yeah.
Awesome. There you go. That's another idea. You want to do something a little bit bigger? Well, then rent an hotel, But there's many ways. Sometimes we are a little bit close-minded, and we're like, okay, if God called me to do this, I just to do it like this and like this. And sometimes God wants to break that box and take you to other boundaries, explore other options. And it's just wonderful to see how in a house, Dr. Emerson has been able to help a lot of people. And we've been interviewing some of their patients, and their stories are just wonderful. God Natural Remedies, that's all what it takes. Well, friends, thanks for watching. Remember to subscribe to the channel to know more about ministries. Here in OCI, we're all about helping ministries thrive. So if you want to start a ministry, or if you already have one, contact us. The links are going to be in the description below. Also, if you want to know more about Emerson Clinic, we're going to put the links in the description below so you can know more about it. Thanks for watching, and see you on the next one.